Hi guys, Dr. Taylor here. We are at Willowbridge Chiropractic. I am just going to discuss with you guys a little bit about how chiropractic technique may look a little bit different now that we are in the second trimester. We are starting to have a little bit of a bigger belly, and how our technique sort of changes and what analysis system that we use as chiropractors. So I actually use the Webster analysis system, and it is a specific chiropractic analysis system and adjustment that is going to be focusing a lot on the sacral subluxation and any sort of SI dysfunction. And this is going to improve the neurobiomechanical function of the pelvis. And so we do some other soft tissue work with the sacrotuberous ligament, with the psoas muscles, with the round ligament, and we'll kind of dive into more about the round ligament in a little bit. But I want to talk about a little bit too about why we are going to be looking at the sacrum and the SI function. So when we're looking at sacral subluxation, it even gets hard for me to say, and pelvic imbalances, they can contribute to difficult labor, uterine nerve function, and pain while baby is growing and we are developing throughout that second trimester. And we want to try to create spaces comfortable for baby and mom. So we're trying to create that space that's a little bit bigger through adjusting the sacrum and adjusting the pelvis in a gentle and specific way. And so the benefits that we see when we are adjusting the sacrum and the pelvis are just decreased low back pain, decrease in the pubic symphysis pain, decreased sciatica pain. We're going to look at how the biomechanics of the pelvis are actually going to improve throughout adjusting, improved labor times, as well as creating optimal space for the baby like we talked about. And it's just a safe and effective way to help you through the second trimester as well.
Yeah, and I'm Dr. Renee from Shift Physical Therapy, here along with Dr. Taylor, just to talk about kind of those benefits of both chiropractic and physical therapy care. So Dr. Taylor referenced a lot of the same muscles that we would focus on in physical therapy during that second trimester. So talking about psoas muscle, talking about some of the ligaments of the pelvis, things of that nature. So obviously in the second trimester, as the belly is growing, you're going to start to feel some aches and pains. So hormones are changing. We're getting some laxity in the pelvis on those ligaments that support the joints. So it's really important. It's a great time to really start learning some more about strengthening of the core muscles. And that can really complement well what Dr. Taylor is doing in the chiropractic realm as well. So I think it's really important to learn some safe techniques for core strengthening. So we're definitely going to be showing some demonstrations of safe ways to do some core strengthening over that second trimester, because it starts to get uncomfortable to lay on the belly as the belly's growing, and it also becomes unhealthy to lay on your back for an extended period of time during the second trimester, because it can really compromise blood flow to mom and baby. So we're going to be showing you some really great demonstrations of core strengthening in some different positions. So stick around for those.
Yeah, absolutely. Hi everyone, Dr. Taylor here. We are at Willowbridge Chiropractic, and we are actually in my office, and I am here to talk to you guys about what you can expect when you come in to see me, and we are dealing with the second trimester. So like we said in the previous video, we are looking at that baby is growing, so that means belly is growing, and how do we accommodate that when for chiropractic and what you can expect. So what we are using is actually our pregnancy pillows. If you can kind of see, our pregnancy pillow has like this hole in it. This is where you're actually going to be placing your belly. And what's great is that our tables can actually shift and move to make you most comfortable. So this headpiece will come up. You'll be able to place your belly right into here, and creating some more comfortability for mom. Oftentimes when we have pregnant women come in, actually they don't really want to get up off the table after they've been laying here, because it's just a little bit more comfortable and we're getting that decreased pressure off that low back. So What you're looking at is that we're getting you all set up. What we're going to be doing is utilizing our table and the drop mechanism. So our table actually will pop up, and just with a light pressure, it'll go right down. And this is going to be very safe and effective and gentle on the patient, and allow to restore that function within the sacrum, and allow for more room within the pelvis for baby to grow, and more comfortability. So what we see is that often mom comes in with some low back pain, some low back tightness, and that's just causing some discomfort all around. And once we're allowing that sacrum to be functioning properly and in the right position, we're just seeing that increased function and decreased pain. Another thing that we see with moms that come in is with a lot of round ligament pain. And what I mean by that is at the sides of the belly, we're gonna have some tightness. And we just hear like, it just hurts on the sides. And what happens is that we have a round ligament, a ligament that's attached to our uterus. And you can almost look at the round ligament like the tethers or ropes on a hot air balloon, and the balloon is the uterus. And once that uterus is growing, the ropes on the hot air balloon can become a little bit tight. So what a chiropractor does is look at those round ligaments, find which one is tight, and just gently massages that round ligament to allow that release tension, and improves that round ligament's ability to stretch and not be so taut, and then relieving that pressure around the abdomen for mom. So if you are a pregnant mom that has experienced some round ligament pain, some sacrum or pelvic pain, and are looking, or just looking to see a chiropractor and see what we have to offer, we would love to hear from you. You can always go ahead and give us a call at our office at 763-645-1192. And again, I am Dr. Taylor, and we are so excited to be a part of your pregnancy journey.
Thanks, Dr. Taylor, for that wonderful demonstration of the pregnancy pillow and what chiropractic care looks like during the second trimester of pregnancy at Willowbridge. So we're back here at Shift Physical Therapy, and we're going to show you a couple of safe ways that you can start some core strengthening during the second trimester. We've been talking a lot in this video about the pelvis and the sacrum, so we've got a little model here for you. So this is the area that we're talking about that oftentimes causes some pain and discomfort for pregnant women. So right here in the center is where we've got the sacrum, and oftentimes these joints on the side can be a very painful area as the baby starts to grow and things are changing in the belly and the pelvis area. So core strengthening is really going to help support this entire area throughout the second trimester. So I'm going to be inviting Jackie to come around and show us, I'm going to take her through 2 safe ways that we can do some strengthening in that second trimester and beyond. So I'll scoot out of the way here. The first position I'm going to have Jackie get into is leaning forward onto the desk or maybe a countertop at home. So in this position, she is able to start working on pulling her belly button up and in toward her spine. So just kind of drawing that belly up and inward. And this can be really comforting during that second trimester, maybe taking a little bit of pressure off the back. But we're going to take this one step further today and add a little leg kick. And what that's going to do is help activate the glutes. So as she's doing this, she's tightening the tummy muscle and kicking that leg straight back. The one thing I would caution her against is avoid lifting the leg too high. And with that, we can see that back start to arch, and it can create some discomfort in the back. So just a slight leg lift in this bent forward position. Perfect. So the second exercise, I'm going to have Jackie grab a little water bottle here, or maybe you've got a small weight at home. But with this one, we're going to be in that standing position. So with this, she's going to put one foot in front of the other. And then as she lifts that water bottle or small weight up forward in front of her, she's going to be drawing the belly button in toward her spine. So again, tightening those core muscles and providing a little bit of resistance by adding a small weight in that arm. Perfect. And then she can switch to the opposite side and do that same thing. So as you can see, standing, leaning forward, these are some great ways to do a little bit of strengthening for the core muscles, much safer than laying on your back or laying on your stomach, which can become a little uncomfortable starting in that second trimester. So those are just a couple of ideas on how to get started on a little core strengthening during your pregnancy.
And if you have any questions or concerns or just not quite sure if you should be in certain positions or not, feel free to give us a call at Shift Physical Therapy and Wellness. Our number here is 763-645-1113, or you can also head to our website and fill out a free consultation form. Bye guys!